Hi everyone, happy Tuesday. This is Vivi. Today is the first day after the inauguration, and it actually feels a little bit weird because I live and work very close to DC. It's almost like you can feel this gloomy vibes in the air. As someone who works in life sciences, I've been closely monitoring Trump's executive orders associated with healthcare policy, insurance, Medicare benefit, drug pricing, etc. There are two healthcare issues or topics I personally keep a close eye on, which are first, if Trump administration is going to reverse or restrict the Medicare Advantage supplemental benefit for seniors with chronic disease. And the second topic is if Trump is going to implement his proposed approach for addressing the mental health issues. And to be specific, if Trump is going to bring back mental hospitals or mental institutions in the US and enforce institutionalizing people struggled with mental health issues. While we're waiting for the policies and waiting to understand the implications for patients with mental disorders, I figured I'd just use the lunch break to do a short vlog and share some of the books I've read about mental disorder and mental health crisis in the US. The reason I want to do this vlog is not only because mental disorders as a disease state that's so close to my heart, but also because I've had this question for a long time. Is institutionalization the right approach for addressing the mental health crisis we're seeing now? The first two books are by the same author, Jeffrey Lieberman, Shrinks, The Untold Story of Psychiatry, and this is the second book of the author, Malady of the Mind. Lieberman was a former president of the American Psychiatric Association. There has been some controversy about him personally, but that doesn't change how great these two books are. I personally love this book. So the prevalence of schizophrenia in the US is like 1%, roughly. So it's not like cancer. Yes, schizophrenia is not the most prevalent disease. Unlike patients with cancer who are usually or becoming more and more vocal, patients with schizophrenia still feel like there's an inherent shame associated with the disease, and you don't hear people talk about schizophrenia or a mental illness that often. For us normal people, it's very difficult to picture the life of a schizophrenia patient. And in this book, you will see all the brutal history associated with mental hospitals, mental institutions. You will see all the unbelievably inhumane treatments for schizophrenia patients and the pain they had to suffer. The next two books, Bedlam and Waiting for an Echo, they are not about schizophrenia specifically, but they touch on the same question. Is locking people up, either putting them in jail or enforce the institutionalization of people with mental illness, the ultimate solution? Or does it create a vicious cycle? Other than giving medications, increasing the dosage, there is no holistic support system to bring people back to their lives, or at least to prepare these people for going back to their normal life. And then people get worse, you extend the institutionalization, and people are forever trapped. Bedlam is the nickname of the first mental hospital in England, also the first mental hospital in the world. If you have ever watched American Horror Story Season 2, Asylum, all the horrendous stories, the scary scenes you watch in the show, it's probably 3 times worse in reality in Bedlam. If you're interested, search the name up, and it's almost equivalent to medical practice brutality, craziness. I want to end today's vlog with two more hopeful books. The first one is, this is my favorite. This is so good. The Center Cannot Hold. The author is schizophrenia patient herself, but she has accomplished so many things, of course, after so many struggles. She's now a professor at USC. She was forced into hospitalization in UK while she was studying in Oxford. Her journey is just so poignant and hopeful. Her success or overcoming all those hurdles is definitely driven by multiple factors. the treatment, medication, the holistic support system, and then not just medication, but also like behavior therapy. And one thing I want to call out, there's an underlying risk or underlying issue with enforced hospitalization or institutionalization, which is the diagnosis. Unlike cancer, you have all these different biomarkers, the lab tests. There is no such thing as standard test to diagnose schizophrenia and many other mental disorders. The providers rely on DSM-5, also known as the Diagnostic and Statistical Manual of Mental Disorders. Basically, it's a list of 11 questions, and providers make diagnosis decisions based on judgment. So who got to decide whether a patient should be hospitalized, institutionalized, or not? Because one person's judgment can be so dramatically different versus the others. The last book I want to share is by Asian American writer. Her name is Esme Wang. I don't know if I pronounced her first name right. Esme, Esme. She's also considered as a high-functioning schizophrenia patient, and I love her essays. She's very active on Instagram. She's in a very, very difficult time. But I just hope she can continue to write and publish more books. Alright, that's today's vlog. See you.